Hello, thank you for joining me. This is Dr. Erica, pharmacist. Welcome back to my channel. I'm going to talk briefly about pharmacokinetics, also known as pharmacy drug distribution, which occurs in the body. So once a medication is consumed in the body, then there are so many, well, things that can happen. Four of those I will go over that are very important and that we should know as pharmacy health providers. So again, pharmacokinetics is a part of pharmacology, and it is also grouped with pharmacodynamics as well. So we'll go stick with pharmacokinetics on this particular video. The first category or um, very important subgroup is going to be absorption. So once the medication is consumed, we're talking about oral medications. Oral medications such as tablets, liquids, um, um, those melting tablets, also um, lozenges, medications that are swallowed through the esophagus down to the stomach, down through the large intestine, small intestine, so forth. So that's what we're talking about as far as pharmacokinetics. So once a medication is absorbed, we look at the rate and extent to which it's absorbed. Now, how fast is absorbed and how much is absorbed. Not 100% of the tablet is going to be absorbed. Not 100% of the capsule is going to be absorbed. Some of it is going to go straight through. Some of it, most of it, hopefully, will be absorbed. And then the rate at which it is absorbed will affect the time of the medication being in the body, how fast the medication will begin to work. So do be considerate of that. Now, this particular topic or video may be appealing more towards the pharmacy students, those medical students. So do be aware of that. If the terminology and medical terms that I utilize in this particular video might not be understandable. So do understand that. So thank you for joining me. Please like, share, and subscribe. I'm Doctor of Pharmacy, and I'm just going to go over again these four subgroups. And so, rate and extent of absorption will affect the medication's bioavailability. Sometimes you hear me say bioavailability. That means biologically how much of the medication is available in the body. So that will determine again the bioavailability, the fraction of drug absorbed is an important determinant of the extent. Again, the fraction of the drug absorbed is a part of the extension of the bioavailability. And it's affected not only by the physiological barriers of the stomach lining, of the intestine lining, but it's also depending on the pH, it's depending on other medications that are taken um, with that medication. Also, whether there's food in the stomach or there's an empty stomach or there's other interactions like grapefruit juice or there's been a heavy meal or fatty meal that's been taken right before. Those are determinants of how extensive the medication will be absorbed through the lining of the stomach, through the lining of the intestines. So do be knowledgeable about that information. Now, the distribution refers to how much the medication is actually expanding throughout the body. So there are uh, different, I guess, proteins and plasma proteins and organ systems that do affect drugs. Sometimes the drug wants to stick stick to stick to the plasma protein. Sometimes it wants. Sometimes the drug wants to stick to the organ system. So when that happens, the drug it sticks to the organ system. It sticks to the plasma, then the drug begins to become less distributed because it's now bound to plasma, and that affects the distribution or the concentration in the body. So do be aware of that. So tissues do play a role. protein play a role, how great the affinity for the drug to these proteins can affect the distribution. And the distribution will also affect the time at which the medication peaks in the body and the time at which the medication eliminates in the body. So once those proteins and those drugs begin to disassociate, once they disassociate, the drug can now be eliminated, or it can go ahead to the site of action where it needs to work, or it can rebound back to another protein. So there are different things that can happen with medications and proteins. Okay, so metabolism. We'll go over metabolism. It's approximately 50% of the drugs undergo some sort of liver hepatic metabolism. The the metabolism of the liver will help the medication become more soluble and break down the medication into different other medications. Sometimes inactive medications are formed that can be eliminated through the kidneys. So once the metabolism occurs in the liver, that medication can now go through the kidney elimination or excretion. So that goes to the last and final um, category of pharmacokinetics: excretion. Excretion happens in the kidneys. So the kidneys flushes out drugs that are no longer effective, that are no longer needed in the body or inactive. So once we have that knowledge, we can give out that information to the general public, letting them know if you have bad kidneys or if you have kidney disease or kidney failure, this particular medication works directly with the kidneys. It does not go through any hepatic metabolism. It goes straight to the kidneys. So if you have kidney failure, for example, that medication will remain in the body and will not flush through the kidneys. So organ system functioning is very important and plays a very, very valuable role in this particular subcategory, which is excretion. The primary purpose of hepatic metabolism is to increase a drug's water solubility for kidney excretion. Now, filtration clearance is the product and glomerular filtration rate are the products that are most important. Creatinine clearance, you might hear lab work about that. Glomerular filtration rate, you might hear things about that when taking labs. Also, you'll have your doctors usually, especially with older patients, geriatric patients, will have their kidney function tested to make sure that they are eligible for certain medications. If they're not eligible for certain medications, then of course they might have to receive a adjusted dose for a particular medication. So when I say in certain situations that a medication has to go through a dose adjustment for creatinine clearance less than 30 or less than 25, for example, that means that a patient has to have at least kidney functioning of at least 25 to 30, creatinine clearance of at least 25 to 30 for this medication to work effectively and not cause a toxicity. We don't want drugs to build up in the bloodstream, in the plasma. If that does happen, it builds up, then that's toxicity. That drug is no longer therapeutic, it's toxic. And so we don't want that to happen. We want to make sure that patients have at least a certain creatinine clearance or glomerular filtration rate that promotes the filtration of a drug properly. So do be mindful of that. So that's the four categories of drug distribution: pharmacokinetics, absorption, distribution, metabolism, and then excretion. So thank you for joining me. Please binge watch on all videos that I have. Watch this video again. And also, please like, share, and subscribe. Subscribe. Thank you and have a great day. Bye-bye.